Now, even though we're going to go behind the muscle, there are different ways to perform this operation. And there are some superior techniques and less than ideal techniques of putting the implants behind the muscle. I think two factors that the surgeon has to take into consideration when he does this operation is we're going to go behind the muscle, but the muscle needs to be released in certain areas in order to make room for the implant. What do I mean by that? Every muscle has an origin and an insertion. The muscle that we're talking about is the pectoralis major, and the origin of that muscle is along the sixth rib here, the sternum, the clavicle, and it inserts on the humerus. Every muscle goes across the joint. That's the muscle we're talking about. Now, the origin of the muscle, of the pec major, is, like I said, on the sixth rib, but that's really higher than the woman's crease of her breast. So you can't have the implant up here and the breast down here. You have to have the implant sitting at the bottom of the breast. We'll wash her up with some Betadine here, magic solution. One has to release the muscle from completely on the bottom, but the key is what happens over here. A lot of surgeons are reluctant to even touch the muscle over here. They're afraid they're going to cause symastia or what have you, or bleeding. But it's critical to release the muscle immediately, because otherwise you're not going to get a good cleavage. And there's strong muscle here, and over time, implants are just going to wind up being in the armpit. So it's critical to release the muscle completely, slight transition and no transition. And that transition needs to be smooth. The second is there is a layer above the muscle called the pectoralis fascia. That layer needs to be preserved. So a lot of surgeons will actually release the muscle just from on top of the muscle and just cut it this way and slip the implant in there. But in order to do that, that fascia gets disrupted and that the muscle will retract up superiorly with very little muscle coverage of the implant. So you don't want that either. Contrary to that technique, the best way to release the muscle is from underneath so that the fascia stays intact, not touched, and the muscle can still be released. And that's what we're going to do.